Hi, this is Mary. September is Chiari Awareness Month, and I'm reaching out to you today on behalf of Chiari Bridges and Chiari Action Network in regards to a topic called Acquired Chiari. It's very important to learn about yourself, and we want you to take time this month to stop and do some research regarding what might be causing your Chiari. So if you have additional questions, there are articles on chiaribridges.org that may be able to help you with these topics. So stop and do some research for yourself this month, and hopefully you might be able to learn more about what's happening with your body. Acquired Chiari is something that there's many different topics that I want to talk to you about, but first I'm going to give you a couple of tips. One is to keep a very detailed symptoms list of yourself. You can keep that on your phone. I kept it on Notepad on my phone, and then I would make changes or additions as time went on, and I could print that list for doctors, so it was very important to make sure that the symptoms related to myself. The next thing is always getting a copy of your reports and your scans. So if you are diagnosed with Chiari, making sure that you're getting a full brain and spine MRI, and you're asking for a copy of those discs, and then asking for a copy of those reports. Also, if you have any tests run, getting a copy of those tests. If you have any surgeries done, asking for a copy of the surgical reports and keeping those on file. MRIs, imaging places, only keep copies of your imaging for a few years and then they are discarded. So it's very important because this is your medical history. So please make sure that you're getting everything done prior to look at the whole picture so that you might be able to get the proper treatment. Okay, acquired Chiari. There's several things that come to mind when we talk about acquired Chiari. Ehlers-Danlos syndrome, connective tissue disorder, hydrocephalus or intracranial hypertension, CSF leaks, tethered spinal cords, and also cranial cervical instability. I don't want to talk about Ehlers-Danlos syndrome and connective tissue disorders. So those can vary in degrees. They can be very difficult for some people and cause a lot of problems with subluxations and dislocations. And for other people, they might not be affecting them that they notice very much at all. Some people think that you need to be flexible and bendy, and that is true for some types of the Ehlers-Danlos syndrome, but not every type. And we also have to remember as we age and we have pain, we become stiff. So keep that in mind when you're thinking about if you have Ehlers-Danlos syndrome or connective tissue disorder. Also, what causes your body to have problems is your body is pretty much made up of collagen. And when you have a connective tissue disorder, your collagen is faulty. So it can cause things to not be held in place as it should. And this can even be up into your head and your brain. And so that alone can cause problems of things not being held in the correct way. It can cause problems with your spine, and you will see sometimes people that will have a lack of the natural curve. You'll see scoliosis. So there's many things that go along with connective tissue disorders, including some of the other topics that cause acquired Chiari. And when we talk about hydrocephalus and intracranial hypertension, the thing with that is it's basically that your CSF has an abnormality, and it's causing pressure in your head that can cause your cerebellar tonsils to herniate and cause Chiari. So it's very important to have a very detailed symptoms list that might help you get the proper diagnosis and treatment if you do have intracranial hypertension or hydrocephalus. Many times this can be seen on an MRI, but it not always is. So it's very important to make sure that you're getting the proper treatment for this. The next thing I want to talk to you about is a cerebral spinal fluid leak. Now, your dura surrounds your spinal cord and the cerebral spinal fluid. And what happens is the dura can actually become faulty if you have a connective tissue disorder. So what can cause a cerebral spinal fluid leak can be spinal taps, lumbar punctures, epidurals, spine issues, spine problems, and also it can be accidents or injuries, and sometimes it's a spontaneous leak or from a surgery. So what can happen is if you have a leak in the dura that's causing your cerebral spinal fluid to leak, sometimes it can be a very big leak or a small leak, but it can actually cause a funneling or pulling down effect of your cerebral spinal fluid, and it can cause the tonsils to herniate. So in order to properly diagnose this, again, it goes back to symptoms because it's not always seen on MRIs. So very much a very detailed list of symptoms is important, and proper treatment is important because it could potentially save having Chiari decompression if the cerebral spinal fluid leak is causing your Chiari. Another topic is spinal cord tethering. And how this can work is your spinal cord should be free-flowing. It should not be attached anywhere onto your spine. And if it is, that can cause a problem to where it can cause a tugging or pulling and actually cause the brain to herniate. Sometimes your brain stem can actually become lower and also cause acquired Chiari. So also, again, it goes back to symptoms, and sometimes it can even be seen on imaging, but not always. So it's very important, again, to keep a very detailed list of your symptoms. And then also want to speak to you about cranial cervical instability. It's very difficult topic because of the fact that you could have cranial cervical instability prior to any surgeries at all, and then people can have it post surgeries because a lot of the bone or a support system was removed during surgery. So it can cause a lot of problems, and so basically one type of symptom is a bobblehead type effect, but it is very important to seek someone who has knowledge on cranial cervical instability as to the proper treatment. Now, I'm not a doctor and I'm not a medical person, but there are many doctors out there who are starting to learn and become familiar with acquired Chiari. So when you are talking about your symptoms and your treatment, if you have a doctor that wants to treat you the same way as every other patient with Chiari, you may want to seek another opinion. If you seek another opinion and you start to have a doctor that starts to listen to your symptoms and pay attention, and you feel comfortable, then that is one thing to consider. And if you still don't feel comfortable, remember to seek more opinions, because there are doctors that are learning more about these conditions and how it affects people with Chiari. The one thing that we have learned is that if you do have Chiari decompression and you still have problems later on where you might re-herniate, why is that? What is causing your problems? Was it something that wasn't done properly, or was it something that was missed, or did you have an acquired Chiari that was not taken care of to begin with? So people are learning more and more all the time about these topics, and so it's important to discuss them so that we can learn ourselves. So please take the time and empower yourself to stop and learn more about yourself. And hopefully you'll understand that there are additional reasons that can cause your brain to herniate, and so hopefully you can get the right treatment and help that's necessary. Thank you.